Thank you very much. It's a pleasure to be here. And let me start with the words of gratitude and appreciation to the government of Korea, to Korean Academy of Addiction Psychiatry, and our hosts for effectively supporting the WHO meeting that we had during the last 3 days. And now let me present some perspectives from the World Health Organization on prevention of harmful use of alcohol and prevention of other addictions. So let me again present some latest figures which John Saunders just now presented about the scope of substance use in the world. And you can see that the alcohol is being the most commonly used psychoactive substance in the world. Currently, almost 2 billion people consume alcohol within the last 12 months, according to the last figures published by the World Health Organization. Approximately 1.1 billion tobacco and 246 million people using illicit drugs. And these differences reflect, to the large extent, also regulatory frameworks which exist at the international and the national level, starting from 61 Convention for Illicit Drugs of the UN Convention of 1961, more recent legal framework negotiated under the auspices of the World Health Organization, WHO Framework Convention on Tobacco Control, and for alcohol, which has a little bit different nature because it's not legally binding for the governments who ratified conventions. This is a global strategy to reduce the harmful use of alcohol, which provide options, recommendations for the governments what could be considered according to the national context to reduce the harmful use of alcohol in the populations. Why these frameworks are necessary? Why the governments should interfere or may interfere into the matters of personal choice? Because one position which is often articulated in mass media is that every person, every human being has the right to define its own fate, its own future, either to use drugs, to use alcohol, or not to use. The problem and the reason why the national and international frameworks are in place is because the impact of these substances on the health of the populations, and not only on the health of the individuals who consume these substances, but also very often on those who are around them and on the populations, on the societies in general, are so significant that almost all governments in the world, to this or that extent, regulate production, distribution, and consumption of psychoactive substances. Because all of them intrinsically has a propensity to be liked by people, to be liked by our human brains, because their mechanisms are intrinsically linked to the mechanisms of pleasure and motivation in human beings. So, what is the cost, for example, of wide-scale alcohol consumption in the world? 3.3 million deaths every year are attributable to alcohol consumption. And let me emphasize the figures which are given below, percentage for men and for women. So 6% of all deaths, premature deaths in the world, are attributable actually to alcohol consumption. What are the strategies to reduce this higher toll of deaths caused by alcohol consumption? One strategy is, of course, to change the pattern of drinking, reduce the level of drinking in those who chosen to drink alcohol beverages. And majority of people in some countries use alcohol beverages, and many of them have any problems with that. But the second objective, particularly important for countries which have a higher prevalence, higher proportion of people who don't drink alcohol, never touched alcohol, or never touched alcohol in the last 12 months. The responsibility of societies and the governments is to take care of this part of the population, to support them in non-drinking behavior, and to protect from future problems. By the way, for those of us who are involved in treatment of people with alcohol use disorders, we shouldn't forget that a proportion of people who didn't drink alcohol in the past 12 months are actually those who are either in remission or in recovery. So, what are the reasons for these 3.3 million deaths? And of course, we know very well about alcohol liver cirrhosis, which can lead to liver failure and death. We know very well that sometimes very severe alcohol intoxication can result in death. But what are the latest evidence from latest scientific findings? What are other conditions to which alcohol consumption contributes and which can be associated with increased mortality? And let me show, this is the latest figures produced by the World Health Organization, and several conditions are included here which traditionally are not considered as somehow linked to harmful use of alcohol. First of all is cancers, including breast cancer in women. And the next question, which will be very legitimate to ask, does it mean that this impact on incidence of breast cancer is linked to very heavy use of alcohol? And the answer is not. Increased risk of incidence of breast cancer in women is going with relatively low levels of alcohol consumption. After 10 grams per day, some small increases being already observed, and with the increase in grams, it goes further. Recent estimates show several new conditions which were never before considered in estimation the impact of harmful use of alcohol on the health. And these conditions are tuberculosis, lower respiratory infections, and HIV/AIDS. We now have sufficient evidence to say that harmful use of alcohol contributes as well to increased mortality and disability associated with these conditions. That's why, when in 2011, within the United Nations system, the heads of the governments, presidents of countries, meet together to discuss what is the main challenge in public health now, which are facing their health systems and their societies. They unanimously agreed that one of the biggest challenges are non-communicable diseases. Because even in countries where infectious diseases were the major problem in health, nowadays it's changing. Infectious diseases are more effectively controlled, whereas the burden of non-communicable diseases, including cardiovascular diseases, diabetes, cancers, and chronic lung diseases, are becoming increasingly problematic, are becoming increasingly heavy for social welfare and healthcare systems. What are the prevention strategies? How to prevent these conditions? What can we do apart from expensive, with every year more expensive treatment interventions? What are prevention strategies? And there are, based on all scientific evidence, there was 4 risk factors identified which are common for these conditions. And one of them is harmful use of alcohol. What does it mean in practice? It means that prevention activities in healthcare settings, for example, screening and brief interventions were described by previous speaker, should be and can be effectively implemented not only in primary health care, which WHO, World Health Organization, always promoted, not only in some specialized services when you can have higher prevalence, when you can expect higher prevalence of harmful use, but also in the settings which are dealing with non-communicable diseases. Such settings as cancer settings, settings for treatment of cardiovascular diseases, settings when diabetes is in the focus. What are the options to address harmful use of alcohol? How the countries can reduce the level of scope of the problems? This global strategy, which was adopted, endorsed by ministries of health from all countries in 2010, provides a range of policy options which show to be necessary or effective in reducing the harmful use of alcohol. What are the targets? What should be targeted by these interventions? Several issues. One is level of alcohol consumption. And there is a simple message: less is better. The second is pattern of alcohol consumption, because so much depends on how alcohol is being consumed, even with the same level of consumption per week, per year, per life. But how it's being consumed is significantly important for health outcomes. What is the context of alcohol consumption? when, for example, it's affiliated with driving, or when it's linked to some other higher risk activities for health. These all issues are important. But also wider social determinants of health. What are alternatives for young people? What are alternatives for societies? How well societies protect and prevent health consequences of occurring drinking? This all, what are the social norms? How to change social norms in a way that heavy drinking becomes less and less acceptable, and moderate drinking, if for those who choose to drink, and protection of those who are not drinking deliberately should be in place. These are the 10 areas which are outlined in the global strategy to reduce the harmful use of alcohol, which provide a recommendation for the governments for a comprehensive action to reduce the harmful use of alcohol in populations. However, when we, for example, when we have a patient with particular condition that we diagnose, what is our normal tactics? We make, hopefully, correct diagnosis, and then we look, and we know normally, through education, through training, we know what is the best, what is the most efficacious, what is the most effective treatment option that we can apply based on the literature to this condition. And normally, of course, taking into account on individual factors, we apply this treatment option with expectation that we are doing the best for our patient. When it comes to the governments and to the population level problems, imagine that you are head of the government. What to choose from all these 10 options as a priority area to reduce the harmful use of alcohol in populations when, for example, the level of consumption is sufficiently high and the level of problems is sufficiently high? That is why a lot of researchers and public health people, and of course our organization, the World Health Organization, paid particular attention to studies on cost effectiveness of different policy options. How to ensure that with limited financial resources that you may have, you allocate these resources to those interventions that you can achieve the biggest impact on population health with as little as possible investment in terms of resources from your budget, public health budget. Results of the studies up to now indicate that the most cost-effective interventions for reducing the harmful use of alcohol are unfortunately not very popular in the countries, but they are restricting access to retail alcohol, reducing basically availability of alcohol, increasing taxation or raising taxes on alcohol, enforcing restrictions and bans on alcohol advertising, and these are the most cost-effective interventions at the population level. The second line, also cost-effective, but not to the extent as the first three, are enforcing drink driving laws and offering counseling to drinkers in healthcare services that we already discussed. If to speak about availability of alcohol, what does it mean in practice? What actions should be implemented, enforced at the country level to regulate availability? Is providing legal framework when legislations are extremely important for reducing the physical availability so it's restrictions on sale and serving of alcohol. It's implementing and enforcing minimum age for purchase of alcohol, licensing systems for sale of alcohol, reducing density of alcohol outlets, particularly when young people are concentrating, reducing the hours and days of sale. In terms of marketing of alcoholic beverages, there are good initiatives which are implemented by producers of self-regulation, but from all the literature that we know, that we have, effectiveness of these self-regulations is not extremely high, or not at all. The effectiveness is not demonstrated in most cases. So that's why the strategy recommends to have regulatory frameworks, preferably with legislative basis, to regulate advertising and marketing, and also provide some or ensure some sanctions are in place. In policy options pricing, one issue is particularly particularly new now, is being very widely debated in several jurisdictions, is on setting minimum price for unit of alcohol, and of course health services response. Now, as the World Health Organization has one of the core functions to provide normative guidance on most effective interventions, I want to attract your attention to several packages which are in place, which recently been released, which allow health practitioners to see what are the best evidence for effectiveness behind particular interventions that you can apply in a wide range of settings for also for alcohol problems. And these are MH Gap Intervention Guide, brief interventions for not only alcohol but also for other drugs, which is the WHO Assist package, and several other manuals. This is the guidelines that we released last year. It's all based on the review, systematic reviews of the evidence, is on edification and management of substance use in pregnancy. It's a huge problem, not yet well recognized, not yet well appreciated that this is a significant problem, is the impact on drinking by young women on unborn child, on fetus and embryo. And this is what is called fetal alcohol spectrum disorders. This is a big problem, and very often the most vulnerable period of fetus and embryo is a time when pregnancy is not often recognized. That's why it's so important that levels of alcohol consumption in young women of childbearing age is at minimum all the time. And also I want to attract attention that the people, mothers with substance use disorders, are still should be encouraged to continue breastfeeding, and this is again one of the WHO continued policies. Of course, in every time looking at risks and benefits of each case. When we are talking about prevention, I think we already several speakers alluded, primary prevention is very important. And this is the most efficient way to prevent problems in societies, in communities. But when it comes already to developed conditions, countries, governments, health systems have options to reduce health consequences, to reduce deaths, even when conditions are already in place. One example is the recent guidelines produced by the World Health Organization on prevention of opioid-related deaths, because opioids continue to be the main reason for deaths related to drugs. And these guidelines largely recommend wide-scale availability of naloxone for managing opioid overdose. What are the conclusions? First of all, harmful use of alcohol. Alcohol consumption is pleasant on many occasions, but cost of that is higher to societies and to the world in general. 3.3 million deaths. There is several important political frameworks that we have in place, including the UN Political Declaration Prevention Control of NCDs and Global Strategy to reduce the harmful use of alcohol, which provide guidance to what can be done at the population level. The political options have many of them, we already discussed that, and one important message is that to achieve success, society should come together, all sectors should be involved, not only health sector, and we need to share responsibility for the health of current generations and for the health of future generations. Thank you very much.
Thank you so much, Dr. Poznyak, for delivering.